so Chapter 8, this has got a lot of stuff that we're going to cover down the road. You obviously have homework on this, right? So kind of pay attention. We'll talk about different landmarks. We're going to talk about the different age groups. Vital signs in this, just have a pretty good understanding of what's normal. Because a pulse rate of 160 in a 9-month-old baby is not as concerning as a pulse rate of 160 on a 45-year-old man, right? So that's the biggest difference. Just kind of have an idea of what's normal and what's not. Term-wise, infant is birth to 1 year, right? Neonates is what we call birth to 1 month, okay? And that's based on due date. So if the baby is premature, they're still a neonate until 1 month after their due date, right? So if they're 2 months premature, they might be neonates for 3 months of their life because they got to go one month past that due date. Does that make sense? And then we consider infant 0 to 1 year. American Heart Association with CPR follows this exact same thing, right? We have infant CPR, we have child CPR, and we have adult CPR, okay? So that's an infant. So normally, right, about 6.6 to 7.7 pounds, okay? That's normal birth weight. I think it's less than 5 pounds is what they're going to start talking about being underweight, okay? Weight doubles by 6 months and then triples by 12 months, okay? That's pretty straightforward, pretty easy. You'll hear me make the joke throughout the class, I don't mean it to be offensive, is kids have watermelons for heads, right? It's huge, and it's much, much larger than the rest of their body. If they fall, they normally fall on their head because the weight causes their head to gain speed faster than the rest of their body. When they're born, 25% of their total body weight is in their head, right? 1/4 is just that watermelon, okay? Their airway we talked about, narrow and easily obstructed. Okay, the other difference is they are diaphragm and nose breathers. Okay, us as adults, we're usually mouth breathers, or we rely much more on our accessory muscles and not as much on our diaphragm. So kids, we call them belly breathers, right? Because that's where we usually see a lot of that movement is in their belly. This is why stuffy noses can be so dangerous to kids. Okay. Antibodies are passed from mother to child into pregnancy and then through breastfeeding and after the fact. These are the reflexes. Really, we use this more or less to gauge is the child acting normally, right? Reflexes up there, that startle reflex. If you clap your hands in front of their face, they should throw their arms out, spread their fingers. Palmar reflex, take your pen or your finger, rub it in their hand, and they immediately grab your finger, right? Rooting reflex, they turn their head towards the side that's being touched. Okay, that's that hunger reflex. Sucking reflex, sucks when lips are stroked. Sleep patterns, I don't know who put this up here, but they don't have children, right? It says begin to regulate after 2 to 4 months, and they should then sleep through the night, okay? I've heard of people who that doesn't happen for 17, 18 years of their life. So this is pretty just, broad. This is the big one, right? Babies have got fontanelles, okay? This is where we're talking about those soft spots, okay? That posterior, which is on which side? Back, right? That back soft spot closes in 2 to 3 months, okay? We don't really mess with this a whole lot. Now, the anterior one, that soft spot that sits kind of on the crown of the top of their forehead, right? This one can be 9 to 18 months. So this is the one that we tend to use for assessment down the road. What are we looking for? If we're assessing the fontanelles, what are some of the things you can tell with assessing fontanelles? Anybody know? Nah, not age. What do you think? Hydration, right? Because if it's sunken, then they're dehydrated. And the other one is increased cranial pressure. If they have a head injury, the fontanelle actually bulges because the pressure, like we talked about, they've got the opening, right? Because their skull isn't a cap or isn't a vault. It's open. So the brain will actually push out of that spot and create that bulging fontanelle. Okay? So it's a good idea to check those fontanelles on kids. There you go. We talk about this stuff more when we get into pediatrics, but bonding and scaffolding and temperament and trust versus mistrust, you really want to have a kind of a good grasp of what's normal for a kid, right? 8, 9-month-old kid, most of the time you can take from mom or dad and they don't have the attachment disorder or attachment issues like a 1 or 2-year-old kid would, right? 6-month-old kids you can take from mom or dad, and they shouldn't scream, yell, grab from mom or dad because they haven't made that attachment. They're attached to mom or dad, but they don't have that separation anxiety like a 1 or a 2-year-old does, right? Now, if you go to a home with a 2-year-old and the 2-year-old wants to come to you over mom or dad, that should be the big red flag that something's wrong, okay? Whether they're sick, whether they're altered, whether mom or dad has done something that's hurt their feelings or has injured them, and that's why they're more concerned about being with you than they are being with mom or dad, okay? One of the worst parts of this class is when we talk about child abuse when we get into pediatrics, okay? It's not a fun PowerPoint. It's got great information. We start talking about what do you do with kids that are in those situations. Toddler phase, 12 to 36 months, right? 1 to 3 years old, okay? That's the toddler. So we start to change a little. Pulmonary system becomes more developed. Nervous system starts to get a little better. Musculoskeletal system, they start to grow. They start to have, their sleeping patterns change because they're growing or because they've got growing pains. Immune system starts to build. These are the booger boxes, right? Snot walkers, whatever you want to call them, okay? They're always got their nose running. They're always boogery because they're constantly getting exposed to stuff, and they build antibodies for them, right? You want to work on your immune system, go work in a daycare because then you get exposed to all that crap that they're always exposed to. Then you got this teething process, right? Causes fevers, causes discomfort, causes cranky babies. Depending on how high those fevers go, you might be seeing kids because they've got, spiked in temperatures and they're first-time parents. I love going on like first-time parents because you go on them like 5 and 6 and 7 times a month. And then you happen to go there like a year later and they've got 4 other kids and you're like, I didn't know you had 4 other kids. Why haven't you called? They're like, because we had second, third, and fourth child. We've learned by the first child you don't got to call 911 for everything, right? So things kind of change when it comes to what parents are comfortable with and what they're not comfortable with. This age group, this is where you get that separation anxiety, right? You should start seeing that difference in the fact that you really can't take kids away from them. So do your very best to leave mom or dad in direct contact while you're doing your assessment, right? That way you're not causing any more anxiety than needed. That's a magic thinking toddler, in case you're wondering. Preschool age, 3 to 5 years old, okay? Look, a preschooler. So body systems continue to develop. They start having interactive and social skills. This is a little bit nicer because you can start asking questions, right? Now, you can't ask in-depth questions, but you can ask questions like, do you hurt somewhere? If they say yes, you say point to where you hurt, right? They can tell you ouch, they can tell you their stomach hurts or whatever, but these kids are a little better of telling you what's going on. Before the age of 3, you kind of have to look at what their body's telling you and not what the kid's telling you because they don't have that ability. That was it. School age, 6 to 12. Okay? Loss of primary teeth. Again, someone clearly doesn't have children, right? Saying they need less general supervision than the rest of them, which, okay, that's how you want to parent. They start making those decision-making skills. They start to be a little more aware of their self-esteem, and we start getting these, peer pressure or peer-related issues, right? Whether it's positive or negative. 13 to 18. Look, an adolescent. So 2 to 3 year growth spurt, sexual maturity, right? So lots of the changes in the body can cause all kinds of issues. Strives for the independence, so they've been there, done that, they know it all, they don't need your help, don't call mom or dad. They're much more concerned about that body image and peer pressure, a little more prone to those self-destructive behaviors, a little more risk-taking. We start to get into, automobile accidents and things along those lines. The other one is this one right here, the risk-taking, but the other side is they're not really good about telling you what happened, right? It's amazing. You walk into a room full of, 9, 18-year-old kids and you say, what happened? And magically, no one knows anything. No one knows anybody, and they have no idea what their first name, last name, or birth date is. They don't have a clue, right? And you're like, listen, I'm not a cop. You got to tell us this stuff. We can help people, right? Try to get the information out as much as you possibly can. Early adulthood, this is quite the span. Congratulations, right? Now you don't have to say you're an old person. If you're under 40, you're squared away. Thanks, Dan Limmer. Lifelong habits form. This is when you should reach your peak physical condition, just in case you're wondering. Job and family stress, marriage, childbirth, accidents is the leading cause of death in this age group, right? That isn't shocking since the first couple of years of that, I wouldn't really even throw in with the word adulthood, right? So accidents is still a big issue. Middle adulthood, 41 to 60. Won't let you raise your hands. May need vision correction. Cancer, heart disease often develop. Weight control becomes more difficult. Psychological stuff, you start looking at like the empty nest syndrome. Evidently, this can be a negative thing. I haven't talked to very many of those people, but some people get sad when their kids leave their house forever. And then comes this group that might bring their parents into their home to taking care of them. That adds some financial burdens, some stresses, depression we're going to talk about in this next age group, but this can cause some negative effects in their life. Late adulthood, nice thing is we're talking about 61 years until whenever you die, okay? I want you to notice we haven't used the term geriatric, right? According to the textbook, these are the age groups they're talking about. They use the term geriatric, okay? Just kind of keep that in mind. Those are older adults. Body systems become less efficient. Psychological stuff, living environment, self-worth, financial burdens, death and dying becomes an issue whether they lose a spouse or they lose friends. Something along those lines can cause some pretty big issues. The one thing that we're seeing a pretty large increase is the suicide rate in this age group, right, is growing astronomically, okay? We're also seeing this is not usually an intention-getting suicide, right? I have yet to be on a 65-year-old adult, right, or female, male, whatever, who has slashed their wrists, right? I haven't been on a 65-year-old adult who has taken a handful of ibuprofen and called 911 and said they tried to overdose, okay? These normally involve firearms, okay, or very, very lethal means of doing so. This isn't attention-getting. This is a means to an end, right? They lost a spouse they've been married for, 50 years or whatever. They lost all their family, or now they're a burden, whatever the case might be. We had a couple in Deer Park a couple years ago that had taken poison. The husband had taken it first. The wife then had taken it. He went into cardiac arrest, so she called, and so we arrived. We take care of him. We managed to get pulses back, stick him in a helicopter, and fly him away. About that time, she goes into cardiac arrest, right? So we're like, perfect. So about this time, we're now connecting the dots that there's clearly something, it's either in the air or so they've ingested something. So we were on the cardiac arrest on her. We managed to get her pulses back and send her to the hospital, right? So 2 times, we've got 2 separate people back from dead to pulses. They get to the hospital. Week and a half later, we get staged out for law enforcement at the same house. We show up, and she's got a gunshot wound through and through her armpits, and he's got a gunshot wound to the head. And what happened is they resuscitated him at the hospital. They discharged them. They came home. He shot her in her sleep and then shot himself, right? They don't do attention-getting, okay? We screwed up their plan initially. They found a different way to do it to make sure we couldn't fix it, okay? That's pretty common. Like I said, what's that?
My dad went on one like that.
Yeah.
They set their house on fire and
Yep.
then shot her and then shot himself.
Yep. Happens in this geriatric population. It happens more than we think it does, right? So maybe pick up on those. We'll talk about suicide patients when we get into like mental health and stuff like that, but pick up on those red flags. Go ahead, sir.
So, if you're the first responder, what do you do to like clean up and all that?
Not a whole lot. That's the coroner.
The family, well, like we're sure to like call someone to clean it, but do you just take the body?
No, EMS doesn't even take the body. That's coroner. That's EMS. We cover them up, and that's it. If we started IVs, we don't even take the IVs out. We shut the bag off. We lay the bag down. If they're attached to an AED, we unplug the AED from our machine. We leave the pads on, everything. Because every death is investigated to some way, shape, or form. Law enforcement might walk in and go, this is natural, and that's the end of the investigation. But stuff involving firearms, even like cut and dry suicides, usually get investigated a little bit farther, right? We had a gal, she was like 22 years old, been married for a week, got in a fight with her husband, went inside the house. Husband went outside to chop wood because he was fired up. Hour and a half later, goes inside, bathroom door's locked. So he breaks in the bathroom door, and she's laying in the bathtub, and she's dead. So he calls 911 and says what happened to her, but she's laying in the bathtub, and she's not breathing. We show up, and there is blood everywhere, right? His tunnel vision does not see the fact that she got into the shower, she turned the shower head on and backed into the shower head and stuck a gun in her mouth and blew her head off. All the water was to wash the blood down the drain. So law enforcement gets there, and due to the fact that it was a female and a firearm, which doesn't happen very often because it's too messy, they investigated it for 6 hours, trying to prove that he had murdered her. because it didn't add up. Females don't normally use firearms. And so we're there like, we had pulled her out of the bathtub, and so law enforcement wants to know, what'd you move? What did it look like? Was there blood? Why is it clean? And you have to like put all these pieces together to understand what went on because of how rare it is with like females and firearms, right? Normally they don't do messy techniques. Hangings is the other suicide that creates kind of an issue. They want to know what were they hung with. They want to know if there was an object underneath them that you moved that appears they were standing on it. They want to know, who found them, who cut it down, how did you take them down. All those things are documented or talked about.
So you have to assess the patient, right, before you declare anything.
Mm-hmm.
How do you take
cut them down. Yep, we cut them down. Which, like I said, of all the suicides, nothing is better than the others. But like poisoning and stuff like that are usually cleaner and easier to kind of walk in and be like, you know what, they're gone, and have that conversation than firearms and hangings and stuff that can be a little bit on the gray area side. Any other questions? That's literally the end of this chapter, so that's why.